Hello, and thank you to whoever is joining me and viewing my presentation virtually. My name is Dr. Lodhie. I'm currently a third-year family medicine resident, and my project over this last year is called Improving Childhood Developmental Outcomes Through Culturally Sensitive Screenings. I worked on this project with the help of Dr. Christopher Hiromura, so I wanted to say a special thank you to him for helping me through this process. So this idea came actually from another attending physician of ours, Dr. Borden, who highlighted the various pediatric developmental skills that are out there for our well child checks. This inspired my idea, which is to update the current childhood developmental screening tool at family care specialists from the Denver scale to a more culturally sensitive and updated tool such as ages and stages. This idea hopes to address and mitigate disparities in care, such as inaccurate referrals for behavioral or language delays. Oftentimes, the milestones we are evaluating our pediatric patients by at their well child checks are very limiting in their nature, very all or nothing mentality, but as I'm sure most families and parents know, babies and children develop in various ways at various timelines, and so it's important that we adapt how we measure success for them and can guide them in the right direction from there. By improving developmental screening tools, we're not just affecting change for our pediatric patients, we're potentially impacting their future as adults by appropriately diagnosing the need for early intervention when it comes to speech, language, or behavioral delays. Our clinic has been using the Denver developmental screening tool for many years now, and this has been the standard of care among many outside primary care and pediatric clinics as well. This tool specifically was developed in the 1960s, and since then it has only had one singular revision with updates in the 90s. The Denver tool has been found recently in many studies to have lower sensitivity, specificity, and validity when compared to ages and stages, which can be seen in this chart that I have on the top left from the American Academy of Family Physicians. So ages and stages, the questionnaire is considered much more updated and culturally inclusive than previous screening tools. And given we work in a very culturally and ethnically diverse society, it's important that we use something like this to better identify milestones in our pediatric population. When we use outdated sources, which don't take into account the nuances between location, race, ethnicity, culture, access to education, proper nutrition, we're ignoring these really valuable differences in our community, and we're ultimately not providing the most accurate or evidence-based assessments for our patients and their growth and development. The goal of decreasing misdiagnosis of language and behavioral delays will allow space for culturally sensitive and relevant expectations for the population we serve. Some background on the Denver screening tool. So like I mentioned, it was created in the 1960s. It was one of the very first screening tools to identify children at risk for developmental delay and disability. It was based off of a similar format to the pediatric growth chart with a total of 105 developmental items from birth to age 6, and those were divided into 4 different domains, including personal social, fine motor adaptive, language, and gross motor. The bar graphs, as you can see, for each item indicate the age at which certain percentiles of the average child has completed that task. There have been growing concerns in the last few years regarding low sensitivity in diagnosing children with speech and language delays specifically. So this tool was revised and re-standardized in 1992, which was the most recent update. This is a sample of the ages and stages questionnaire. As you can see, it's not necessarily based on a bar graph like the Denver scale. This questionnaire is given to patients' parents when the family first arrives. It includes questions regarding communication, gross motor, fine motor, problem solving, and personal social skills. But it also has a series of open-ended questions with yes or no answers as well. Questions are then totaled, put into score-specific ranges, and that quantifies the overall developmental goals for that patient. So with all of that information, the objective of my own project was to increase the specificity of developmental screenings for disorders of speech and language during well child checks at family care specialists to 95%. This project was initially intended to be a prospective project and to see the outcomes of the newly implemented screening tool in our clinic. However, our transition to a new EMR pushed that timeline just a little bit. So instead, what I did was I gathered data retrospectively to assess pediatric patients that all of our current residents have in their census. And I included ages 0 to 5 for simplicity of referrals done during our 3-year residency here. I then combed through all of these 100+ patients from our prior EMR to see which of them were referred mostly to the regional center for any of these developmental concerns, specifically speech. I then was able to use the diagnosis code F80.9, which is for developmental disorder of speech and language, to identify the specificity of those referrals for an actual diagnosis. The second part of my project is hopefully something that will continue over the course of the next year. So currently paper copies of Ages and Stages are ordered to be used at family care specialists to replace our prior tool. And ideally in the coming months, we're able to fully integrate this tool into Epic as a proper template in our EMR. Once that's been incorporated, we would have to train our resident physicians, attendings, staff to use the tool, enter its data, and hopefully this time next year, we can continue to monitor referrals to regional center and see if we have a more specific test. So like I mentioned, the sample size I chose was to keep between current residents so that the patients could be followed from here on. The total sample size was 101 pediatric patients ages 0 to 5. Out of those 101, only 9 were actually screened positive for disorders of speech and language delay and were referred to Regional Center for Diagnostic Testing and Confirmation. Out of those 9, only 2 were actually diagnosed with a delay, so the specificity of our screening tool reached 93%, which isn't too bad, but the positive predictive value of that test was 22%. I was not yet able to calculate the sensitivity of our test because we don't yet know how many patients were a false negative or possibly had the diagnosis but were missed initially. So moving forward with this project and plan for our clinic, we want to implement mandatory training for all of our physicians and support staff in using Ages and Stages. We want to work with our management team as well as our IT team to integrate this tool into our EMR for quicker use and scoring. We'd love feedback from not just our physicians on their use of it, but also from clinical staff and how they distribute it, patients, parents, or families and how it is to take it and their overall impression of it. And after that, quarterly reviews of referrals from now until next spring to track the same diagnosis, which can help us ultimately compare if any improvement has been made. The goal of this project is really to just create a culture of inclusivity and understanding into all well child visits at family care specialists. We want to allow a more sensitive and diverse approach towards assessment of childhood developmental goals and milestones, while also decreasing ethnic biases in diagnosis of speech and language delays. And hopefully, if it proves to be successful, we'd love to share these outcomes with neighboring clinics for eventual widespread implementation and standardization of the Ages and Stages questionnaire. So this is a list of my references and then a poster just to conclude. Thank you all for joining. If you have any questions, please feel free to reach out. Thank you so much for your time.